Ladies and gentlemen, thank you, Sundar, for that kind introduction. I must thank Sapiens to have given me this opportunity, and Umesh also for giving this warm welcome here, and IMA Mumbai West for this opportunity to speak to you about the salt and health. Salt and sodium are considered to be same, but they are not similar actually. Sodium constitutes 40% of salt, and 60% is sodium chloride, is the chloride part in the sodium chloride. So 1 gram of sodium is equivalent to 2.3 grams of salt. And as Umesh said, edible salt accounts for more than 90% of salt consumed in India. Although this may be changing now with the younger generation, because the food consumed from outside, and especially the preserved foods, are now being consumed by the younger generation. So the quantum of food, salt consumed may vary now from the younger to the older generation itself also. Small amounts of, if you don't add any salt, even then some amount of salt would be there inherent in every food itself. So about a gram of salt maybe in various foods, even if zero salt is added from in the cooking, there will be some amount of salt in the food as well. The recommended daily consumption of salt has been emphasized here many times earlier. The WHO says 2.3 grams, which is equivalent to less than 1 level teaspoon salt, which Umesh has been very passionate about, ki ek chammach. And he has even said that there could be a hole in the chammach itself and you could eat less than that. Now, how do you convert how much of sodium in a salt? 5 grams of salt is 1 teaspoon, level teaspoon contains 2 grams of sodium. 2.5 grams of salt contains about 1 gram, and 1 gram of sodium, salt is about 400 milligrams of sodium. So that could be the kind of calculation that you will find out. How does sodium is handled by the body? Sodium is a very important anion in the extracellular fluid, is very, very important to the nephrologist, is bread and butter basically every day. Every patient is involved with some alterations in the body fluid and all that, but it is very important anion for controlling extracellular body fluid. It is important. This article in American Journal of Hypertension actually hurt my nephrology ego, because I always thought that kidney was the only organ which controls the extracellular body fluid through sodium, excretion or conserving sodium. But this article tells me that and they did this study on the travelers of Mars 500 study, and looked at, before their travel, at different amounts of salt, 3 grams, 6 grams and 9 grams, and looked at the body changes with proteomics, metabolomics and sodium MRAs. And then they found out that not only kidney is the only organ, but heart, brain, skin, muscle, they remain the stores of iron as well as. And most of the iron, most of the salt studies have been done acutely actually. Few days of salt, either you increase it or you decrease the salt. There are not many studies which have been done in a randomized fashion, as well as for prolonged salt high intake at this. So this is what they had done, given these quantities of salt over a period of about 6 to 9 months, and then continue to study their proteomics and metabolomics and come out that which is very, very different. So I would suggest all the nephrologists to, because this definitely hurt my ego at least, because I always thought that kidney is the only organ which is maintaining salt and water balance in the body. But there is a huge change in when you alter these things in the body, and there is a large amount of alteration. So kidney, in addition to kidney, heart, liver, as well as brain and skin, muscles contribute to the regulation of salt in the body. Sodium is extremely important in the body because every cell is, the sodium and the potassium in the body, as was said, controls the electrical activity in the nerves, every cell in the body. The the potential, during the physiology classes that you use the muscle activity as well, and the nerve conduction potential, which the technician used to get it for us actually, many times, was the one is controlled only by sodium and potassium in the body. Potassium is the major intracellular anion, and sodium is the most important abundant extracellular anion. So it is important for controlling volume of the body. So sodium allows the movement of water across various membranes in every cell of the body. What is the impact of excess salt in the body? And you can already been talked about hypertension, the most important one. And hypertension is the commonest comorbidity which is responsible for high cardiovascular mortality. The highest cause of death as a predisposing risk factor is hypertension. And salt has been incriminated in a dose response curve to the etiology of hypertension. So salt is directly related, and as was shown times immemorial, hunter-gatherers, the quantity of salt we were using millions of years back was 0.25 grams. It's only that as we civilized and salt was taxed also, and so as was said, salt and this comes salary was basically because Romans were taxed for, and the salary was paid to the Roman soldiers through salt. So salt over the years went up as we got more and more civilized, and our incidence of hypertension, heart attack, stroke, dementia, kidney failure, and Bharat was talking about osteoporosis, renal stones, stomach cancer. All these have been affected by high salt intake. Elevated blood pressure is one of the most important events that occurs because of high salt intake. So high salt intake is directly related to hypertension, and hypertension becomes one of the leading causes of cardiovascular. In the body, as I said, and it was highlighted by Dr. Bhandari as well, that when you increase salt intake, if you are taking more salt, it's very important to take high amounts of potassium, because potassium counteracts the bad effects of salt. So, and potassium is highly abundant in vegetables and fruits. And the quantity of vegetables and fruits occasionally in our diet may not be as high as one needs to be. The salt intake in Indians is somewhere around 10 to 11 grams. And the amount of potassium that is corroborated to that diet is lower in our country. So one must consume higher amounts of potassium because they counteract. And it's also therapeutically utilized by physicians that when you have high blood pressure, even when you just control it by lifestyle, just increase the amount of fruits and the amount of salt will go down in your body. How much is the recommended sodium intake? And it varies from various age groups. In children, actually, not more than 500 milligrams of salt may be required. For first 3 years, 500 to 600. Then as we grow, somewhere around 1.5, 1 gram to 1.5 grams. And then as we grow into an adult, 5 grams of salt or 2 grams of sodium are required. And potassium, as was also highlighted by Dr. Bhandari, that somewhere around 3,800 to 3,500 milligrams of potassium are required by a healthy individual. And your salt intake should be somewhere around sodium of 2.3 grams and salt of about 4 grams. And then children, again, it's a progressive increase from childhood to adulthood that you increase the amount of potassium in your diet. There is a study, multiple studies which have looked at salt intake in India, and you look at all across the country actually. The average would be around, but look at Kashmir, I belong to Kashmir, 22 grams, 24 hours urinary, and the best way of estimating how much salt one is taking is by during a 24 hours urinary collection and looking at sodium over a period of time, and then you do a 24 hours and you find that salt of 21 grams of salt, and that's because of the salted tea that is drunk by Kashmiris during winter months, and that gives them very large amounts of salt. But you can see that on an average, the amount of salt consumption in India is almost double the amount that has been recommended by WHO. And I think Dr. Daksha made a very high point that as a public policy, it's extremely important for us as a country to chart out a plan that over the next 10 to 15 years, the salt intake, both through advocacy, government interaction, industry participation, and people like you and me who work with the patients directly, as well as have a hold on our patients, and therefore are able to convince them that we need to look at salt. It is important first to get hold of that you are taking high amounts of salt which are bad for your health. And as was said, prevention is the most important thing that each one of us must practice, and for that salt reduction is extremely important. Almost 200,000 deaths occur every year, and these have been accounted for high salt intake in the body. And Umesh also talked about this. The sources of salt, as I said, at the moment, 90% of the salt from most of the studies that have been done are from cooking salt. But as I said, this is changing evolving in our country. The sources of sodium or salt consumption in our diets are almost 80% is through home-cooked food and use of salt, as I said earlier. Why is salt reduction important? And it is important, it's been highlighted earlier, that you will decrease. There is a linear dose-dependent increase in the blood pressure, and I'll show you some studies whether this works. And it is important for causing blood pressure, and blood pressure is the most important risk factor for cardiovascular disease. And reduction of salt progressively from 9 grams to 6 grams to 3 grams has shown a reduction in the mortality of cardiovascular mortality due to coronary heart disease, as well as the decrease in the incidence of death due to stroke. So all of this has been documented. Now this is an intervention study which was done in Portuguese, 2 villages. One village, the residents were asked to reduce their salt intake and they were monitored for this. So there was a moderate salt reduction, and the other village, contiguous village, was allowed to continue the same salt. And these people were followed for blood pressure at 1 year and 2 years. The dashed ones are the lines where they are the ones with the lower salt or reduction of salt. And you can see that at the end of 1 year and 2 years, there was a reduced blood pressure in the group which had reduced the salt intake. This is again a meta-analysis of modest salt reduction trials for more than 1 month or longer reductions. And you can see that the reduction has been varied in the x-axis from, the x-axis shows reduction from the baseline. And you can see that the percentage from 2 gram reduction, 3 gram reduction linearly, or you can see the excretion of sodium goes. So reduction by 130 millimoles per 24 hours, the greater the reduction of salt, higher is the degree of reduction from baseline. On the y-axis you have baseline 0 to minus. You can see the reduction, the greater is the reduction in the blood pressure, level of blood pressure. It is true both in normotensives as well as in the hypertensives also. This is an extremely interesting study. You can start very early, in fact. These are infants who were randomized, and they were randomized into continuing usual salt intake and then modest reduction in salt intake. And this was done for 6 months. After 6 months, the infants were allowed to take whatever they wanted to take. They looked at the children 15 years later. And the children in whom the reduction of salt was done during infancy, 15 years later, they found that the blood pressure in these children was much lower in comparison to the comparative to high salt intake was, or the usual salt intakers. So there is a legacy effect also. So if you start early, in fact, if you start salt reduction in infancy and childhood itself, and this is same true for sugar intake as well. Obesity in children will lead to obesity in the adulthood. So if you start very early giving your children low amounts of salt, you will see a legacy effect which may be protective of them for the non-communicable diseases later in life. There are a lot of myths also about the salt consumption, and I think one is that in a tropical country like ours, many physicians also feel that maybe we need more salt because we sweat quite a bit. There is a belief that in sweat is hypertonic actually, so you don't excrete large amounts of salt. There is some amount of salt excretion, but water excretion is far more than, so you get dehydrated far more. You need more water rather than increase in salt when you sweat. So this is not true. So the fact is that even when you sweat, you will not necessarily need to take large amounts of salt to replete yourself. The second myth is also that we use senda namak, and this is very common, and they feel that senda namak has less sodium in it. The truth is that senda namak has no low sodium. It's the same amount of sodium as is existent in other forms of sodium, be it black salt or rock salt or whatever salt. And as was emphasized earlier, it doesn't have iodine, and iodine replenishments are required for many of our patients because of the endemic areas of iodine deficiency in our population, and that's why this is required, and this has also been highlighted. So this is again another myth which is not necessarily true. So I would stop here and would let Ravi talk about the next talks, and maybe we'll have questions at the end. Thank you very much.